So, welcome to my dear students and learner. So, today we are going to learn how this SGLT2 inhibitor works. So, already in my previous lecture, we understood what is diabetes and what is the role of various glucose transporters. Those are GLUT and SGLT. How it is using with the help of these transporters, how the glucose transports from bloodstream to various cell and all, and in case of hyperglycemia, how the glucose level in the blood increase. So today we are going to learn about the SGLT2 inhibitors and its mechanism. Okay. So normally this SGLT2, that is sodium glucose linked transporter 2, these inhibitors used to reduce the blood sugar level in type 2 diabetes. Okay, in commonly for any anti-diabetic drug, it is used to increase the insulin level in the body in case of type 1, or to increase the insulin sensitivity in the body in case of type 2, so that the glucose absorbed from the bloodstream to the cell and the glucose is utilized for the metabolic action as a energy to produce energy. So naturally there will be less glucose in the blood. Okay, but in SGLT2 inhibitor, this works in slight different way. That means the excess glucose from the blood, it is excreted through the urine, and naturally the sugar level in the blood is controlled. So in the market, normally the doctors will prescribe these inhibitors. So those are the three common SGLT2 inhibitors. So the prefix is gliflozin. So those are dapagliflozin, canagliflozin and empagliflozin. So this is sold in India with the brand name of Pafagol 10 mg. Okay, anyway, I am not going to promote any particular brand, but still this is the very popular brand name in India. So these are the three commonly used prescribed SGLT2 inhibitors in India. To understand the mechanism how this SGLT2 inhibitor works, we need to slightly understand the detailed mechanism of kidney. So normally the blood with some unwanted molecules and minerals, it will be coming to the kidney through the renal artery, and then the necessary filtration and the reabsorptions, it will be taking place inside the kidney, and the unwanted water with unwanted molecules, it will excrete in the urine, which will balance the pH level between the blood and the urine. And then the after filtration and the absorption, the blood with necessary molecule, it will again transport through the renal vein to various organ of our body. So the kidney is the unit of kidney, we know it is called nephron. and in a kidney, in a healthy kidney, there will be approximately 1 million of nephron. So if you see the structure of the nephron, then the first, there will be this round shape, this area, it's called glomerulus and the Bowman capsule, and after that there will be tubule, which is called proximal convoluted, this up to this, it is called proximal convoluted tubule. Then it's this U-shape area, it's called loop of Henle, and distal convoluted tubule up to this. From here up to this, it is called distal convoluted tubule, and after this is the collecting duct, and then it will be, after that this will be the filtrate, it will be excrete as urine. Okay, so the glomerulus and the convoluted the glomerulus and the convoluted the glomerulus and the convoluted tubule, that it will be in cortex area, this area, in the cortex area of the kidney, and the loop of Henle and the collecting ducts, it will be the medulla, inside the medulla of the kidney. Okay, so normally the water, when the blood is entering through the renal artery inside the Bowman capsule and in the glomerulus, the water and few small molecules are filtered from the blood, and it will enter in this convoluted tubule, and finally it will be, and after that there will be some reabsorptions, it will be taking place, some necessary molecule and water, again it will be reabsorbed from this convoluted tubule to the blood again. So this process, this reabsorptions and this entire mechanism is called the natural dialysis. When the kidney and the nephron, when the kidney, it will be failed to do this filtration and reabsorptions, then these things should be done in an artificial way, which is called artificial dialysis. Okay, so the first, in the glomerulus, the filtration, it will take place. That means some molecules, it will, and the water, it will get filtered, and as a filtrate it will enter in the proximal convoluted tubule, then it will travel in the loop of Henle, then distal convoluted tubule, and then it in the collecting duct, and then it will excrete as urine. Now when our glucose level is high, then the glucose also getting filtered. In normal physiological condition, this glucose again it will be reabsorbed in proximal, this glucose again it will be reabsorbed in the proximal convoluted tubule. Okay, so now in case of hyperglycemia, to control the blood blood glucose level, if we can stop the reabsorptions in this glucose in the convoluted tube, proximal convoluted tubule, then it will be remain in the duct, and finally it will be excreted in the urine. Okay, so now if you see the inner lining of proximal convoluted tubule, then it will be something like this. The lumen side, the inner side of this duct, there will be SGLT2 transporter, which helps the glucose to travel from the inner side of the duct to the cell, and then with the help of GLUT2 transporter it will come to the interstitial fluid, and from there again it will go to blood. This is the normal condition. Now, as the name suggests, if we apply the SGLT2 inhibitors, so this will stop to transport the glucose from the convoluted tubule to again blood. So the blood glucose level, it will be reduced, and the excess glucose, it will be excreted through the urine. This we only want in case of hyperglycemia. So this is the simple mechanism of SGLT2 inhibitors. So in summary, what these SGLT2 inhibitors do? So normally, in normal physiological condition, when the glucose is filtered in the glomerulus, and while it is traveling through the proximal convoluted tubule, then with the help of SGLT2, the reabsorptions of the water and glucose will take place, and it will travel from the lumen to the interstitial fluid, and then again it will go to blood. And if we apply these SGLT2 inhibitors, this will stop this reabsorption of the glucose, and this glucose, it will come out from the body through urine, which will maintain the less glucose or the sugar level in the blood. This is the very simple conception. This has so many side effects. You know, as in normal condition, in normal body condition, there will be no glucose in the urine. So once the glucose or the sugar in urine is increased, so there is a possibility of urinary tract infection. So many fungus may grow inside the urinary tract. Okay, this will cause also the weight loss, and as we are partially stopping the reabsorptions of water also. Okay, so this will cause frequent urination, and more water it will come out from the body. It will cause dehydration as the liquid is coming out. So there will be it may cause low blood pressure and weight loss. And sometime, some case study I have seen, it may, after applying of this SGLT2 inhibitors, it cause the diabetic ketoacidosis. What is that? Normally glucose is the source of energy in our body. This will enter inside the mitochondria, and it will produce energy. But once the more glucose is coming out in the body after applying these SGLT2 inhibitors, then body will experiencing the lack of glucose or lack of energy in body. So that time liver will activate, and it will breaks the fat as a fuel, and this process will produce some acid called ketones. So this condition is called diabetic ketoacidosis. This also maybe one of the, means I have seen few cases, this will be one of the side effect after the application of SGLT2 inhibitors. So hope you understood the concept and the mechanism of SGLT2 inhibitor and how it works. Thank you so much. Thanks for your patience.